Good morning and welcome to the PDS Virtual Connect Conference and to this special panel discussion on healthcare. We're delighted that you could join us today. This has been quite a year so far. It has presented a continuous string of unprecedented challenges around the world and in all aspects of our lives. Individuals, organizations, and industries have needed to adapt quickly to a new abnormal, which is fundamentally impacting how we work, how we live, and how we deliver and receive goods and services. And medical care has been no exception. The pandemic is profoundly impacting how healthcare is delivered in the US and around the world. Patients, clinicians, healthcare workers, and administrators are all experiencing the impact. And they're all preparing themselves for the inevitable fundamental changes in patient care and population health management as we wait to get to the other side of this unimagined pandemic. While healthcare systems have come under tremendous pressure, we've seen a lot of innovation as well. And information technology has been at the center of it, whether it has to do with reducing human error, improving clinical outcomes, facilitating care coordination, improving practice efficiencies, or tracking data over time. Information technology has been at the center of it all. Now today, I'm delighted to say that we've assembled a great panel of thought leaders from across the industry consisting of information technology executives. And they'll discuss about the emerging role of information technology within the current context, the related challenges, and how they're thinking about addressing issues. So let me introduce our August panel here. So alphabetically, we have Pam Benshi, who's the Vice President of Clinical Informatics and Transformation and the CIO at Western Reserve Hospital. She's responsible for all information systems activities, including implementation, design, analysis, installation, and operations. We also have Tamara Corbell with us, who's the Executive Director of Data Center Products and Services at Paragon Development Systems. She has a dual role where she focuses on two areas. One is corporate IT security as the company's Chief Information Security Officer and the management of the company's professional and managed services. We also have with us Dave Lundahl, who's the CIO and Vice President of ITS at Children's Hospital of Minnesota. Dave is responsible for strategic direction and technical support of all information systems supporting the associated hospitals and clinics. We also have with us Jonathan Shoemaker, who's the Senior Vice President and CIO at Allina Health at Minneapolis. Jonathan has the responsibility for Allina Health's information services, clinical equipment services, and health information management. And then finally, we have Dr. Jordan Tannenbaum, who's the CIO and CMIO at St. Peter's Healthcare Systems in New Brunswick, New Jersey. He heads up a team responsible for all IT within the hospital. Welcome to you all, and thank you for being here. To kick the discussion off, let me request each one of you to take a couple of minutes, approximately 2 minutes, to talk about your role at your respective organizations, and perhaps most importantly, what's at the top of your minds. So, Pam, would you please start us off?
Yes, good morning, everyone. Thank you first of all, for having me today. So my role is the Chief Information Officer at Western Reserve Hospital. As mentioned, I am responsible for all of the clinical and business IT functions. We are a small community hospital in Northeast Ohio. I'm also responsible for the IT services and structure for a large independent medical group as well. So I have the team of individuals who have come together and done an excellent job continuing to move us forward. What's uppermost on my mind, I think, is probably similar to the other panelists, is what is the future going to look like? Our strategic plans that we put in place several years ago have taken a change, and trying to understand where we need to navigate ourselves going forward. So thank you again.
Thank you, Pam. Tamara, would you like to go ahead?
Yes, good morning. Tamara Corbell. As Asif has stated, I'm the CISO for PDS as well as the Executive Director for Enterprise Products and Solutions. My role really is to help customers, including healthcare, drive to their initiatives and find success. And what I've been really seeing in the last 6 months really is a change in focus to things that are really driving the outcomes that are needed, specifically to COVID and protecting an organization. And so I'll be very interested to hear on the panel discussion on your perspectives of how that has impacted your entities and how the focus has really shifted and changed, and how long that's going to last potentially, and driving some of the healthcare initiatives that are happening today, such as increase in mental health and patient outcomes, and how that's changed as well. So thank you for having me on the panel.
Thank you for being here, Tamara. Dave?
Hey, good morning. I'm Dave Lundahl. I'm Chief Information Officer for Children's Minnesota. In that role, it's my pleasure to serve with a great team of other healthcare professionals in leading them to support technology at our organization. And I think the other key role in that, in my position, is to ensure that Children's has a technology vision that we can act upon. And I think with top of my mind, COVID has brought on a pivot. It's brought on a pivot for the organization, and we're all adjusting to the different circumstance that we find ourselves in. And as technology is so key to the delivery of healthcare, of course, we need to adjust, maybe not so much overall what technologies we have, but the priorities of those technologies and when we use those and leverage those technologies. So that's key to my mind, is supporting that pivot and supporting our IT organization in the dramatic change and circumstance that we're in.
Thank you, David. Jonathan?
Morning. So Jonathan Shoemaker. While I'm the Chief Information Officer, I'm also the Improvement Officer for Linus, so I somehow managed to get an extra I in my title. And really, what I would say is the balance point there is around not only bringing the collection of technology services and solutions and analytics to the organization, but also ensuring that we're using them in a way to continuously improve how we operate the company. Lina being, what I would say is a sort of a classic healthcare system of, about a dozen hospitals and a number of clinics. As we are in the midst of, both the COVID period, I think that this is a top of mind conversation around how do you recover out of a COVID year, but also how do you transform? And what do you need to look like long term? And how do you actually use the period of time that you're in and really coalesce around the crisis of the day and create focus around what is it you need to be in a more sustained fashion, not only as a technology solution department, but also as an organization. And I think that's a top of mind for me and part of the discussion today.
Thank you, Jonathan. Jordan?
Hello. So I'm the CIO and Chief Medical Information Officer at St. Peter's Healthcare in New Brunswick, New Jersey. It's a 400-bed university teaching hospital with about 100 clinics. We have a medical staff of 1,000. My job is, CIO, typical CIO duties, overseeing everything that has the word computer in it. That's our motto. If it has a computer, you need to let us know because we don't like shadow IT. Also, my other job as CMIO is obviously to adapt the clinical technologies to the clinical application to the patient, helping the physicians and nurses adapt to it and modifying the product accordingly. So we were in the middle of the epidemic. We were in crisis mode in April, very bad. We had like 5 ICUs going that we made up. We had a full hospital of COVID patients, and we dealt with the whole thing. And I think one of the takeaways is, you know, before COVID, we were on several kind of crawling along several paths like telemedicine and patient engagement and being more efficient with our resources. And COVID just kind of slammed us and said, well, now you have to do that now. So I think it accelerated some of the trends that we're all, you know, dealing with and forced us to make very quick decisions and examining these things at a more rapid pace, which we were forced to do. I think top of mind now is we can't drop off that, but then our revenue stream is being hit so hard. How are we going to do that? How are we going to make all this improvement, make all this innovation, and do the things we need to do with less revenue? And that's a real stickler. And I'm hoping to learn from my colleagues here what they're up to.
That's good. Thank you very much. Yeah, I know all of you have raised some very, very critical points. Let me just hone in on a couple of the things that you just mentioned. You know, in just like every other industry, healthcare has tremendously suffered from job losses. I think the statistic was that in March, end of March, healthcare alone had like almost 1.5 million job losses. Since then, things have improved a little bit, but we're still, as of latest reports, 1 million jobs below where we used to be before the pandemic hit us. So within that context, how is your organization's investment in technology moving forward? What's going on and what are your concerns? So perhaps, Jonathan, you can start us out.
I think it's a, you know, this is a complicated conversation. I think for us in IT, it's always a challenge. There's a balance of being looked at as a really just a bottom line cost to the organization, and that's true. At the same time, there's an unending thirst for technology. And, you know, what I would say is my organization, we have gotten smaller as an IT shop every year for the last 4 years. So we have slightly fewer analysts and staff in the department, and yet we have more products, right? People aren't asking to get rid of technology. And so it's a constant battle to figure out not only how to optimize what you have, how do you create more automated solutions and process to what you do, but how do you create more transparency to what it is you have and really help partner with the organization to understand what it is they need. Part of that also is the financials of the future for us certainly are not going to get cheaper. A lot of the cloud solutions and the technologies where they're hosted, you're moving to an operational model for cost that is maybe 3 or 4 times the traditional model. And so really proving that out and showing the value of that is really, really critical. And I would say IT may be forced in a lot of ways to be the most transparent, the clearest in terms of true value to the organization than any other segment. And so when we're looking at a period of time in the next 18 months where revenues are 10% less maybe than they have been traditionally, it's more critical than ever that we truly understand and show the value of that investment, but also the hard decisions that are going to have to be made and choice points around transformation and the value and the role of technology in that is so critical. And so you really have to help prove that out to the organization to understand the why behind all those expenditures.
Those are great points. You know, we all know as technologists that technology improves exponentially. Often we think linearly, but technology has the possibility to scale our operations non-linearly. So one could argue that it could better absorb the job losses because we could scale with technology. Now, David, let me pose a question to you. As you move forward and plan for 2021, what kind of pressures are you seeing in terms of how you're going to plan for the technology for IT, especially information technology?
Yeah, so I think planning needs to follow what the organization's strategies are, right? Whether they be operational tactics or strategies. And so, you know, of course, as the organization responds to COVID, the technology plans need to support what those responses are. And I think in our case, you know, it's a clear pivot because the world has changed, and in some ways we think it's changed permanently. I think as Jordan, you know, indicated, you know, revenues are down. Jonathan said revenues are down, and we are absolutely seeing the same thing. And it's tough to predict what those revenues are going to be next year. So the efficiency and the return on investment, I think, is critical. And investing in technologies that have a return, you know, those rise up in priority versus other ones. And so something, for instance, like process automation. Process automation is something that is showing benefit across industry. It has some instances in healthcare that have been fantastic, but it's not widely adopted. And so process automation, I think, is an example of something that we absolutely have to embrace. Priority shift. So virtual care is now, it was something that has always been viable, I think. I think it's always been. There have been use cases for virtual care that are convenient, that create, you know, access at the right time, at the lowest cost, you know, setting, but it hasn't been generally part of our model. And, you know, I think conversations that you may have had on it, we've had on it across the industry in the past have been speculation because, you know, no one's really participated in it at a full scale. So now we have, due to COVID, we've adopted it at a full scale very dramatically across the board, right? I don't know there's anyone that didn't adopt virtual care across the board. And so now we can talk about it in a real way, and we can talk about it in the access that it provides and the convenience that it provides. There's always going to be, you know, still the gold standard is still going to be, you know, physical setting, but it has a place now, and we all recognize that it has a place, you know, permanently. And so our technology needs to support that virtual. So I would think return on investment technology to support the efficiencies, the bottom line efficiencies that we need to support the top line reduced. We need those bottom line efficiencies, and we need to support digital.
Right. But one of the things about the virtual care is the reimbursement.
Yeah.
It's a huge factor because, for instance, in New Jersey, no area is considered rural. So Medicare never paid for any kind of telemedicine anywhere in New Jersey. So you couldn't get reimbursed for that. Our managed care contracts did not reimburse for telemedicine. So until these waivers came in, it really wasn't financially viable to do it. When the waivers came in, we went from doing a couple of hundred visits to thousands of visits a month.
Yeah.
And there was definite, you know, a benefit from it for sure. And I agree with you, Dave, 100%. And I think Director CMS said, you know, the genie's out of the bottle. Well, it's out of the bottle as long as they don't recork that bottle.
You know, Jordan, as I was preparing for some of the questions that we might have today, I actually thought of the cat's out of the bag or the genie's out of the bottle. You know, what's the right analogy about virtual care? And I landed on the genie's out of the bottle, just as you just said there, because, you know, genies can do magic. They can do good things. They can create things. And I'm hopeful that the genie's now out of the bottle, and you cannot put the genie back in. I mean, it's always been something, again, that's viable, but it's not part of the payment structure, right? Which makes no sense. It's part of a value model, which I hope we increase the value model in this country, but it has value, so therefore it should be paid for.
I agree with you 1,000%.
No, I think we telemedicine, that's a subject near and dear to my heart. We'll get to that and a little bit. Pam, how has this COVID-19 impacted your investment in technology at your organization?
It has really moved the needle, as previously mentioned. We have been accelerated into doing things that we had on our radar to do. One was the telehealth, which is again a topic of all of our minds. The other thing is we were struggling initially with the restricted visitation. And so we creatively came up with a way to use inexpensive technology without adding a lot to the bottom line, while being able to contribute to the quality of care of our patients who were unable to see visitors. That was a very big community and patient satisfaction. We used inexpensive technology, iPad minis and Zoom, and provided that for our patients who had either end-of-life situations, whether that was related to COVID or not. So, we pulled ourselves together and said, how can we continue to be creative, continue to meet the patient care needs of our patients and our medical staff as well. And as a nurse, that's very important to me as well. So, by my professional background, I'm able to bring into some creative ideas and creative solutions around that. We did look at all of our technology, understanding what we needed to do and how we could partner perhaps with other vendors. So we did bring vendors into the environment and the equation, and the outpouring of creative technology solutions. Temperature kiosks, just to name a few. So, we adopted those as they fit into our area and provided support.
Thank you, Pam. Tamara, let me bring you into the conversation as well. You have a unique blend of experience and expertise. You have spent quite a few years on the healthcare side, as the CIO, as the head of IT, and now you are on the other side, on the supplier side. How are you seeing, especially from your expertise of IT security, how are you seeing the change in how organizations need to address the security side of IT?
Yes, I think Dave stated the word pivot. What we're seeing in the industry of what's changing is the potential outsourcing of a security operations center. We're seeing a lot of organizations not being able to meet the requirements of both audit and incident response. And so we're having a lot of conversations regarding the outsourcing of SOC to healthcare and other industries as well. I think that just due to the furloughing, the reduced impact, as Jonathan had stated, of FTEs, and finding those professionals that can really hone in on ensuring that you're securing an environment, which is ever changing and has changed dramatically with some technology components since COVID has been occurring in our world. I've seen that drive for outsourcing really just be an exponential growth. So that's what I've seen, I would say, the number one component within the industry.
And I would agree.
Go ahead.
I'm sorry. I would agree with that as well. The increase in threats and the increase in the need to be more mindful and to have an uppermost awareness. And so we too have a small IT department, and I have recently been fortunate enough to hire a director of information security, and I'm working with her to, as you said, look at outsourcing some of those services that we just don't have the labor to do. But the need is there.
Let me switch to a topic that I think all of you raised earlier, which is this virtual care or telemedicine. It's incredible what has happened in that world, right? So many of us for years have been fighting to address this, the barriers, the cost, the access, and the federal and state and local regulations. And it seemed, pre-COVID, it seemed like it was going to be years before we actually caused that cat out of the bottle or genie out of the bag or whatever expression you want to use. But it's amazing how quickly those barriers have collapsed. And hopefully the genie will stay out of the bottle and some of those relaxations will actually become permanent. I mean, I was recently looking at some statistics that in 2019, during the entire year, there were 50 million telemedicine visits across the country. Right now, the projection is there will be over 1 billion before this year is over. All of a sudden, it's more than an order of magnitude, and all of these because all of these barriers have really come down, and there's a need. There's a common interest on part of the patients and the clinicians to actually do the consultation safely and remotely. So let's go around the table and see how you are addressing. Pam, let's start with you. What's your telemedicine strategy and practice right now, and where do you see it going?
Yes, it did take a big leap very quickly. And so we were one of only about 5% of our population and our providers, to be honest with you. It wasn't a technology that all of our providers embraced. They do like the hands-on with their patients, and they do like to talk to families. So we had a little bit of a time where we continued to educate the providers and our community as well. We are a community hospital, and so we reached out to many community leaders to help assist us with, the process. So we went from about a 5 or 10% adoption rate for televisits all the way up to an 80% in a very short period of time. Some of that required the support of the IT teams and for the technology to be able to support that. We've leveled off. We're now down to about 50%, but it has maintained some benefits, and a lot of our elderly population are finding that that's a little bit more flexible for them as opposed to coming into the office.
Pam, have you noticed any difference in the outcomes as you compare telemedicine to in-person visits?
I would say yes, because it has also assisted, because between the hospital and then our independent medical group, the primary care physicians are on the community side in their offices. So the transitions of care have really been benefited from the televisits, as the patients who might have an acute episode in the hospital and as they are transitioning to home, the providers can then provide what they believe to be, and I would agree, better quality care because they can actually see the patient. So as opposed to, a congestive heart failure patient who might be going home and then they want to have a visit in the office, the providers and the families feel better about having that eyes on by the provider as opposed to waiting for a follow-up visit. So I would say yes.
Good. Dave, I know you've been leading the effort in your organization to implement telemedicine. How's that going, and what your experience has been so far?
Well, I think the first experience was it was a land rush, right? So that we went into lockdown and we needed to dramatically increase virtual care. So we leveraged the technology that we had, which was supporting a very minimal amount of virtual care, of televisits. And we were able to pull it off. And I think through an effort of continuous improvement, we have made it better. However, it is not fully what we want it to be because we were using technology that was in place for a minimal amount. And so we need to add process. We need to add integration. We need to make it easier to leverage the technology both for the clinicians and for our patients and consumers. We need to do those things. We're doing pretty well right now. So we're in process of, okay, this is now permanent. Every specialty, every part of the organization is deciding, okay, how much of our business, where it used to be, less than 1% to 0, how much of our patient care needs to be conducted virtually or can be conducted virtually to benefit, right? And from a data standpoint, we know that satisfaction is very good with it, and I anticipate that outcomes, they have to improve if access improves. We know if access improves, outcomes improve. So we're in process of how do we make this just work really, really well? And I think access and ease and convenience are a key part of that.
Jonathan?
Yeah, I very similar. We went from 50 video visits a day to about 5,600 video visits a day in a 2-week period. And so lots of, I mean, it was a massive change event. And I think it was a real, no pun intended, but it was a real, injection into the arm on this one. And to me, I would say the future is, it's a leveling off event. I would say we're stabilized at sort of that 20-25% of our visits now are sitting in virtual care. I think the future, though, is creating that seamlessness of the fully virtual into a physical and creating that in a way that isn't disconnected. I think at the end of the day, a lot of medicine requires an image or a lab. And if you go from having this elegance of the virtual experience into something else that is very much sort of that antiquated transactional process, it's not going to work. And so you've got to look at consumer preference and how are you going to create really an entirely different infrastructure for care on the outpatient setting that allows more of a hubbed approach to some of these critical services, so that when you get into understanding really what the value is of virtual care in terms of early diagnostic all the way into really more long-term, complex care and what's the value there, that in between of having to come in for things and how that's going to work in a way that really helps the patient and really also the provider, I think is really sort of where our heads are at. And we're really trying to spend time on that future state while just supporting what we've put in place to meet the needs of today.
And Jonathan, you mentioned that part of your role is improvement officer.
Mm-hmm.
Does telemedicine enter into your efforts to improve outcomes?
It does. And, it's been an interesting conversation. I think as we talk with our physicians and clinicians, generally speaking, there's a lot of anecdotal evidence that this is really, something that's been really supportive. But we're really needing to understand truly the clinical outcomes and what it is that we're seeing where virtual makes sense, or it may not, and it's creating different levels of complexity and maybe some assumptions on care. And so that is I think nationally, I think there's going to be a lot of studies helping us understand right place, right product. And so, we're balancing consumer preference and choice and desires with the best way to provide clinical outcomes and care right now.
I was, I think within the last 2 weeks, I was talking with a senior administrator from a hospital in Michigan, one of the largest IDN there. And she was saying to me that COVID has fundamentally changed how they are providing patient care. And she was talking about telemedicine. She goes, "We will never go back," and I'm almost quoting her, "we will never go back to the pre-COVID days where we've got hundreds of patients waiting in the waiting room." And that telemedicine is actually helping us do that. So Jordan, as you think about the role of telemedicine in your organization, how's that going? And tell us about what your experience has been with the technology.
So great question. So we had a telemedicine solution, and echoing what everybody else said, very limited usage, mainly a couple of departments. And we were already having some questions about that particular technology, mainly that patients had to sign up for an account and download an app to be able to participate in the session. And we had already been finding that that's a big barrier. We also have a large Spanish-speaking population here. The product was not in Spanish. So we were already kind of thinking we better, look for something else. Then COVID hit, and we needed something else today. So what they say? They said use FaceTime, use Duo. Problem with that is both ends, again, have to have the app, and you can see the provider becomes in your contact list. So the providers didn't like that because they didn't want to be called back later. And so we went over to DoxyMe on very short notice. DoxyMe was a very inexpensive solution. It was appless on the patient side. They just got a link and it basically opened a web page in their phone. It was very effective, but it did not integrate with the EMR. And on an enterprise level, it was a little weak in terms of reporting and some other stuff that we were looking for. But it did fill the gap. Then our EMR vendor, which was Athena, came through. They integrated telemedicine into the product, made it a single click for the provider to open up that screen while they were documenting. The appointment was integrated, and we went that way, and we've stayed that way. So that's been our technology journey there. In terms of, I mean, I agree with what Jonathan and Dave said. You know, we're looking for the right medical and clinical balance for telemedicine. You know, as a physician, there is only so much you can do with telemedicine. But the big thing about it is one of the problems we're all facing now is even if we don't have COVID in the community anymore, or the rate is low, people are still afraid to come to the hospital. They are really nervous. So you really need, as a marketing tool and as a patient outreach tool, to use the telemedicine in that way to keep the patient engaged in your system until they can come back. Even if they needed to come back sooner and they're not, at least you're on a telemedicine conference with that congestive heart failure person or the diabetic until you say, you know, things are really good around here. Why don't you just come in for a quick visit and we'll pick you up there. So it works as a patient engagement tool and a marketing tool as well as a clinical tool. But I totally agree with Jonathan's comments about, well, how do we balance this? What outcomes are we really going to see? And how are we going to work this? And my other pitch to the clinical staff is, even if things went back to normal, we had already underutilized telemedicine as an additional revenue source. And, you know, we all have, maybe ourselves or family members that say, hey, I had a sinus infection. I got on my phone, I got an antibiotic in 20 minutes for $50. I was good with that. You know, are we participating in that market, which is really a different market? It's kind of like the virtual urgent care market. And now, you know, in the lane, you know, they don't want low acuity patients in the ER. Well, here's how you can pick up that business with a very low overhead. So there's a lot to this, but I think that basically it's a new territory in a way that we were all forced into, and we're all trying to find our way. But I always have believed, and I still believe, this is going to be a huge patient benefit.
No, I totally agree with that. Thank you for your comments there. Tamara, let me bring you into the conversation from more from a service provider to the service providers in context. There are lots of technologies that exist for telemedicine, and you know, on the corporate side, we're using many of those for corporate purposes. And frankly, I have personally seen a lot of improvement very, very quickly, much quicker than pre-COVID days. What are you seeing in terms of the movement and improvement in the technology for telemedicine specifically?
Absolutely. I would say ease of use has driven through COVID really, and I think Dr. Tannenbaum was really talking about that there is a need to simplify the technologies that existed previously. It really has to come down to improving the consumer experience in order to improve the delivery of the telemedicine. And if consumers and physicians aren't happy with the product, the adoption rates of the products are not going to be there. So I have actually seen more of that one-click process in which working with doctors for so many years, that's what they're looking for. And as a consumer, that's what I'm looking for as well. And so that has really driven through this process the need to streamline the technology tools that existed previously to today.
That's good. Thank you. Listen, I've been keeping an eye on the clock, and it's amazing. We're almost coming to the top of the hour, and there's a lot of other questions we could address. Let me just pose one question to you, as you can hopefully incorporate in your closing comments. Take a minute or so, please, to have your closing comments. But I'd like to hear your thoughts on what is one key lessons that we've all learned through this pandemic that should be and can be enduring? So Pam, why don't we start with you?
I think one of the biggest lessons learned is to remain communicative and collaborative across the organization. I think the pandemic has allowed us, Western Reserve Hospital and our Unity Health physicians, to continue to be collaborative at the governance level, at the board level, and to stay communicated and to help make recommendations and decisions for our patients going forward.
Thank you, Pam. Jordan?
Well, I certainly agree with Pam. I think communication, I mean, for us was a survival thing. It was number one and it was great. But I think one of the things that we learned as an IT department was, you know, we were trying to push RPA. I think, Dave, you mentioned that earlier. And we were trying to push other technologies like more expansion of telemedicine. And we were trying to express, we started with Teams, but we hadn't rolled it out yet. And I think our visions for those technologies was correct. And had maybe we been a little more aggressive and a little more forceful. Also, analytics was an area where we were weak and we really had to ramp up very quickly. Yet we knew that. So the vision that we had was kind of correct. And had we been able to advance that quicker, we would have been better prepared. So this really focused not only on how agile we were, but where we were weak. You know, it brought out your weak points. And, you know, some of those weak points we knew about, but hadn't really been aggressive about pursuing. And I you know, the lesson learned is, you know, yes, we're going in the right direction. And we did have support from senior staff. So it was just, you know, our priorities. And I think, you know, going with those technologies at a faster pace and doing some investment to Jonathan's point earlier, would have helped us be much better prepared for where we came. Nobody saw this coming, but it could have been something else. So, you know, lesson learned is go with your gut, go with the trend, and understand the technologies when they come out. If you believe they help you, they probably will.
Thank you, Jordan. Jonathan?
You know, first I would just say it's been a pleasure to just be with you all today and hearing, you know, like minds and really some of the challenges you all have. I think for our organization and really a lot of the work I do is COVID, despite all its complexities, really created this absolute focus in the organization, and focus creates alignment and the ability to execute far more quickly than I've ever seen. And when everybody in the organization is responding to the same problem and creating solutions holistically to that problem, it's amazing how much gets done, how quickly. And so whether that's, you know, sending people home and creating solutions, or creating, you know, 2,000, you know, iPads for teams for remote care in a hospital, to setting up tents out in the parking lots for the ED, everybody's pushing towards the same thing all at once. And it makes you really wonder if you could apply that same focus to fewer things in the company at any point, how much more you would get done rather than doing hundreds of things all at once and everybody having competing priorities. And I think I've been trying, you know, I think that's something we all could take away. And I've been trying to figure out how do we bring that into post-COVID work and focus as well.
Great insights. David?
Yeah, I think I'd like to say a couple things. One is that one of the large technology vendor CEOs said that COVID was driving 10 years of digital transformation into 2 years. And that reminds me of Jordan said this, that we've known what these things are, right? So process automation has been on the board, virtual care has been on the board. I like to keep those these are opportunities for us, right? And you're trying to place, when are we going to do those? When are we going to push for these? And I think a lesson going forward is what we know is the future. Let's push for that a little more aggressively, right? Let's try to get that into the play, because they're going to support the future of healthcare. The other thing that COVID has reiterated for me is focus on the fundamentals will allow you to respond to whatever comes up, right? And I think there are fundamentals to having a very good IT organization, right? So how you measure yourselves, how you engage with your end users, how you do governance, which is prioritization of finite resources that the organization has, how you do change management, how you communicate. Those are all I think fundamentals. And I think by focusing on the fundamentals, if a pandemic comes up, which I'm hoping is a once in a lifetime event, you know, for all of us, when a pandemic comes up, you can respond to it. And then I think we all work at great organizations, and like Jonathan, focus is incredible. And if you have focus and you have fundamentals and really good people, you can respond and you can do great things. And so it reiterates that for me.
That was such great comments. It brings the old adage to focus. The more you focus, the more you see. Great insight, David. Thank you. Tamara, take us home. Any final comments?
Did we hear from Pam?
Yeah, we started with Pam.
Okay, all right, very good. So great comments all the way around. I believe in focus. I have for my entire career. I think that being a very strategic healthcare IT organization means you align to the business and you understand the business. And from a PDS perspective, we did that. We stopped. We did analysis. We looked at what our customers are in need of from a just their perspective, and we shifted our business. And Asif was a great leader to be able to take us through that process. And so from a partnership perspective, we really have taken a step back to ensure that we're aligning and we're partnering with our customers to the highest level possible to ensure that we understand the needs. And I think that alignment is so key, and I'm so excited to hear today that healthcare is embracing this, in which I wasn't in any means questioning that. I think hearing leaders that have embraced the huge amount of shift, the pivot, the evolution of what has happened is so positive for the industry, because healthcare is hard. It is a hard thing to deliver, just all the way from when a patient comes in the door to delivering that quality service to ensure patient outcomes. So I'm excited of what I heard. I thought that everyone just gave such great feedback. So I'm thankful of the time spent here today.
Thank you, Tamara. And let me add to that. I want to thank each one of you, Pam, Jordan, Jonathan, David. Thank you so very much for your time. I hope you thought it was useful. I have no doubt that our audience will take your insightful comments very, very usefully. Thank you so very much. And this brings our panel discussion to a conclusion.
Thank you very much.
Thank you. I enjoyed meeting everyone.
Take care.
Bye now.
All right.
Bye.
Take care.